Timandra WIJESURIYA is 20 years old, just starting her degree at university. She's one of thousands of Sri Lankans who suffer from a condition that can be life-threatening.
Generally, I get the attack in the night, so I sometimes wake up from a dream of I'm drowning or something, and then I realize that I've got the wheeze. And it's sort of like you're trying to breathe. You can breathe, but it's hard to sort of get your breath.
The wheezing attacks that leave her struggling for breath are a common symptom of asthma, a symptom felt by most of these patients seeking treatment through the National Health Service. The disease causes inflammation and a narrowing of the passages that carry air to and from the lungs. Any number of things can set off an attack: allergies to pollen, dust mites and certain foods, air pollution or environment changes. Patients feel as if they're not getting enough oxygen and start breathing heavily.
You feel your chest is getting tighter and you start exhausting yourself to get more and more oxygen. So then there will be it's sort of a panic situation. If it goes unnoticed or if it goes untreated, patient can have a respiratory arrest. What we mean is patient will stop breathing.
Dr. SADIKEEN is a chest specialist working for the Health Ministry. He worked with a Sri Lankan team that contributed to an international study on asthma. It found that asthma cases here have increased by 50% in the past 10 years.
Now the number of cases may be up to 2 million in Sri Lanka itself.
Experts say there is no cure for asthma at present, but proper and timely treatment can help manage the disease.
A large number of children around the country are being treated for asthma, with 20% of 13 to 14-year-olds here found to be severely asthmatic. Experts say the situation is worse with adults, as many neglect or deny the condition.
The incidence of asthma is higher in crowded and polluted cities, but even rural areas are not spared. Vehicle and industrial emissions, changing food habits, and cigarette smoke have been linked to the disease. With up to 2 million people affected, Sri Lanka ranks among the high-prevalence countries. That may not be comforting for Timandra and those like her who have learned to live with their condition. Minelle Fernandez, Jazeera, Colombo.